It's not on the right slide, but we were talking about Dopplers and yes, right here. Can you see ophthalmoscope? The slide on the,
Yes.
yes? Just nod or raise your finger.
Yes, we can see it.
Okay, great. Thank you. Okay, so the ophthalmoscope it's another equipment that it is used to examine the internal part of the eye. However, it is not very often used by regular RNs, by RNs that are uh, generalists. So only nurses that work perhaps in a doctor's office that specialists in eyes like ophthalmologists or optometrists, then they will be able to utilize the ophthalmoscope. But nevertheless, uh, you need to know what it is the ophthalmoscope for and how it looks like. It is used to inspect internal eye structures, and the light source shines light through the viewing aperture, which is adjusted to select the 5 apertures. The aperture includes the large. At any rate, we are not going to go over this because when we study the eye, we will go over that. And this is not one of the skills that you are not expected to do in your skills validation, as well as normally you don't do this in the hospital setting. Unless you have a specialty, like for instance, working in maybe ICU, maybe ED or trauma centers, then you definitely are expected to know how to use it. So that is nice to know, but know what it is used for. So we skip that and we skip this. And now the otoscope is another type of equipment that it is used to inspect. This is the external ear structures. And again, normally in the hospital setting, you do not use it, but in the doctor's office, you definitely use it. So the main components of the otoscope are the handle, the light, the lens, and the specula of the. We will see the equipment in a minute. The specula are used to narrow the beam of the light. The nurses should select the largest specular that will fit into the patient's ear. Okay, so here's the otoscope. And the part that it is right at the end, which is the specula, that is disposable. So whenever you are going to inspect the ear, and this is used externally only, you will see it, you will change it once you check the patient's ears. So the otoscope sometimes is used to inspect the nose too, and for that you will have to use a very short specula. Again, this is nice to know. Cues, you need to know what cues means. Professional responsibilities. Cues are bits of information that hint at the possibility of a health problem. To become skilled at cue recognition, nurses should cultivate their senses until they readily perceive even slight cues. Grimacing, guarding, which is protective posture, or wincing when a patient moves or when a body part is moved during the assessment are cues to examine the underlying joint and muscle for problems or masses. So know what is cue? Cues that suggest hearing loss include not following directions. So when you are speaking to a patient and you say, look up, the patient cannot listen or does not follow commands because he or she cannot hear. Looking at the examiner's lips, or if you see the patient looking at your lips while you are talking, that means the patient cannot hear. Or when the patient answers in a very loud voice, is because they cannot hear how high their voice is. Asymmetry means the features are not equal. Asymmetry of facial expression is a cue to assess function of the cranial nerves. Remember, a stroke, it is a deficit of cranial nerves, and so therefore the lips as well as the face, the eye, will be asymmetric to the opposite side whenever the patient is having a stroke or has a stroke. And so asymmetry of the facial expressions, which means the eye is droopy and the lips are unequal, uneven, you know. So odors are cues to suggest problem with hygiene or drainage from an orifice or wound. Sometimes hygiene is not necessarily that the patient do not care about bathing, but remember, circumstances sometimes do not allow them to do that. Like, what about the homeless? They don't have any place to take a shower every week at least. They just go to the bathrooms and clean themselves with paper towels as best as they can. But so they, of course, they cannot wash their hair. So therefore, of course, they are going to be smelly. But it is significant when the patient has all the appropriate means to take a shower and they don't do it. That means maybe the patient is depressed, or maybe the patient has some type of infection, from an orifice or wound. So smell is is a very significant cue. Critical thinking. Let me see if the rest of the students got back. If not, I have to put them that they are not in class. Okay, so where are
Sir Brandon said he can't get back in. I guess he's having like internet issues.
Oh, okay.
Angela said the same thing too.
Okay. Okay, so remember we study critical thinking, and all throughout your nursing courses, you will be doing critical thinking, as well as whenever you become an RN, you are always be utilizing critical thinking. Critical thinking refers in this class to the interpretation of cues and other collected data that uses the process of critical thinking. So how would you, okay, so let's go back. Once cues are recognized and data are collected, the findings must be interpreted. The data are compared to normative values and ranges. Like, for instance, let's say that you admit a patient with a very low blood pressure, and then they do some lab work, and it turns out that the hematocrit, it is like 22, and the hemoglobin is 8. So that, along with the low blood pressure, what cues are they giving you that? What do you think this patient is having? Hemoglobin, low hematocrit. What does that indicate?
Anemia, maybe?
Yes, bleeding or anemia. Yes, bleeding or anemia. And so therefore, if your blood pressure is low, it has to be due to low volume. So that means you either lost, your blood pressure is low now because you gave antihypertensives, or you gave, not antihypertensive, yeah, maybe, antihypertensive, or Lasix, antidiuretics. So the patient has lost volume, or the patient is bleeding. In this case, you already got the data that it says. So you have to compare the normative values versus the ranges, versus what the patient gave you. Results, the results. You already know that this patient has low hemoglobin, low hematocrit, and also the blood pressure is low. So most likely, when you use critical thinking, that will give you the diagnosis or about the problem. What is the problem? bleeding, or patient is anemic, bleeding, or the patient has anemia. And so either way, you already know that that is wrong. Something is going on there. Missing information is identified after the database is completed with conclusions are drawn. At this time, the nurse establishes priorities of care. So, so the previous slide referred to referred that the data are compared with normative values and ranges. Once data are clustered, patterns are identified. So you are identifying all these patterns that are leading you to the diagnosis, which is anemia or patient is bleeding. So it is your responsibility. So the previous one of your responsibility as a nurse, and when you are doing a physical assessment, is to be able to identify the cues and compare it to the normative values. Another responsibility is to provide in a safe and comfortable environment. So before beginning the assessment, the nurse should thoroughly explain to the patient what is to follow and encourage the patient to ask questions, provide an interpreter if needed. It is the nurse's responsibility to ensure that the patient understands the procedures to be performed and that all necessary consent forms are signed. This will be in the case not necessarily to do with a physical assessment, but if you are explaining that the patient is going to have maybe like an MRI or something, some type of diagnostic study, of course the patient has to sign. In most cases, patients should empty their bladder before examination. And why will they need to do that? Because a physical exam takes at least 15 minutes. A complete physical assessment takes at least 15 minutes. And then whenever they, if they don't empty their bladders, very likely the patient in the middle of the exam will say, I need to go to the bathroom. And then you have to be waiting for the patient there. And believe me, once you become an RN, you realize how important it is to make those explanations and get organized because you are so busy. You should ensure whenever you are doing a physical exam that the room is warm prior to having the patient change into a gown. So you will ask the patient to have a gown, but the room should be warm. Before re-entering the examination room, knock to alert the patient. You should always knock, always. Even if the door is open, you just go knock, knock. It is the nurse. It is, whoever it is, the person. Use drapes to preserve the patient's privacy and to provide warmth. Use the drape to expose only the part of the body being examined and cover the surrounding areas. So you should not, if you are going to do a physical exam, you cannot just leave the patient totally naked in there. No, only expose the area that is going to be examined. The rest should be covered. For one thing, because you want to preserve the patient's privacy, and for another, you don't want to expose the patient to cold. Most hospitals are very cold. To begin the assessment, the patient should be positioned in a sturdy examination table, but this is if you are in the doctor's office. The table's height should be allowed the examination to be performed without stooping, so you shouldn't be bending down. The nurse should also have a stool to sit during certain parts of the examination and a small table or a stand to hold the examination equipment. During the assessment, the nurse should explain each step in advance so that the patient can anticipate the nurse's movements. Alleviate the patient's anxiety by approaching the examination gradually. First by communicating with the patient, then by performing simple measurements such as height, weight, temperature, measurements such as height, weight, temperature, and pulse. What is that? Which most patients find familiar and non-threatening. By the way, most CNAs, and their job is to do the vital signs. Your job as a RN, these nurses have to report any abnormal results if it is one of your patients, and it is your responsibility to confirm and recheck those results before you call the doctor. But most hospitals, they will rely on the CNA to do the vital signs. The examination should be individualized according to the patient's personal values and beliefs. Consider the patient's age, health status, level of functioning, and severity of the illness at all times, and adapt the examination accordingly. Techniques of and equipment of the assessment of the obese patient. To ensure both comfort and safety, chairs in the waiting room and examination areas and wheelchairs used for transportation must be wide and sturdy. Extra large examination gowns should be available. Scales with a capacity of greater than 350 pounds are required. Examination tables should be wide and sturdy with hand bars and footstool to help the patient move onto the table. Examination tables should be bolted to the floor to avoid tipping. If the patient needs help stepping up or sitting on the exam table, use a gait belt or other assistive devices to provide stability and support. Of course, if you have this obese patient, you have to have a large adult cuff or a tie cuff or a special cuff designated or designed for an obese patient, which must be considered for accurate measurements on the blood pressure. Keep the head of the examination tables elevated as much as possible during the examination, because some patients might not tolerate being flat on the bed. If the patient's head must be lowered, the nurse should continue to monitor the patient's respiratory status. Throughout the physical assessment, the professional nurse is required to apply the principles of asepsis. Before beginning the physical assessment, the nurse should wash her hands in the presence of the patient. According to the World Health Organization recommendations, nurses should scrub and rinse hands soap with 40 to 60 seconds when the hands are visibly soiled. So whenever you are really, really soiled, then you use a minute to wash your hands. And a minute is a long time. If you just count the time, you will realize. Excuse me. A specific. And after removing the gloves, you have to also wash your hands before and after contact with medical equipment. Alcohol-based antiseptics, hand rubs in the form of rinses, gels, or foams should be used before and after direct patient contact. Non-sterile examination gloves should be available and used appropriately during the assessment. The bell of the diaphragm of the stethoscope should be cleaned after the assessment of each patient to prevent the spread of the infection. Because remember, you apply either the bell or the diaphragm of the stethoscope on the patient's skin. So that is the reason after you finish, you have to cleanse your stethoscope. Healthcare associated infections are of concern. Hand washing and the use of antiseptic hand rubs are the most effective ways to prevent transfer of infection from one patient to another in both clinical and hospital settings. To decrease risk of infection transfer between patients, medical staff should ensure the proper cleaning, use, and disposal of medical equipment used during the physical assessment. A light disinfectant should be used to cleanse the surface between use of different patients. Equipment that touches a non-intact skin or mucous membrane should be cleaned with a high-level disinfectant between patients. Equipment that enters normally sterile areas or the bloodstream should be cleaned and sterilized between every use. When using medical equipment during a physical examination, the nurse should prepare all the needed instruments and tools in a clean area. The clean area should be draped with a sterile cloth or paper liner, and clean or sterile instruments should be placed on the clean surface. And again, this is if you are doing some type of a sterile procedure, like a poly insertion, you will place your equipment in a sterile area. Normally, when you do a physical assessment, you don't have to be sterile in any way. The only thing you have to do is you wear gloves now because of the COVID, but not because you are doing the physical assessment. Unless, of course, if you are doing an anal exam or a vaginal exam, of course you are required to wear gloves, but not normally during just a physical examination. You are not required to use sterile gloves, but because of COVID, now you do need to do it. Dirty equipment should be separated from clean equipment to prevent potential cross-contamination of infections. Patient hazards throughout the procedure, it is necessary to anticipate potential hazards and modify the assessment to prevent them. Lightheaded, headed, and dizziness because of deep breaths. Remember, every time that the patient, when you are auscultating the breath sounds, every time that the patient feels your stethoscope, the patient has to take a deep breath so you can hear whether there are any crackles, any type of abnormal sounds. So, of course, if they are sick and on top of that they have to breathe like 18 or 16 times, they will become dizzy or lightheaded. That is the reason why in real life and for your physical assessment, the skills validation, you will have to auscultate only 6 areas in the front, right below the clavicles, right below the breasts. If you have a female patient with large breasts, and if the patient is alert and oriented, you ask the patient to lift her or her own breast. If the patient is not alert and oriented, you, the nurse, can lift the breast utilizing the back of your hand, not the palm of your hand, the back of your hand. So I was mentioning that for your practicum, you will do the 6 areas. You auscultate 6 areas in the front, right below the clavicles, right below the breast, and right on the in the axillary area, right below the axillary area, and that equals to 6 in the anterior chest. The posterior, which is the back, you will do 8 auscultation. You will do the 8 areas only. Deep palpation is performed forcefully of a throbbing mass might lead to a ruptured abdominal aneurysm. So remember, that is contraindicated if you suspect or anything like that. And that's it. And this is a long chapter. Okay, so on into the other one. Let me check if everyone is back from break. Wilmer, okay, Wilmer is going to get non-attendance, or maybe attendance at the break, because it's not on camera and he's not answering. Let me see if anybody else. I guess there's only Wilmer. Oh, Alma, you are there. Okay. So let's go on to the next one, the next PowerPoint. Thankfully, the other ones are not, they are long, but there will be many areas that only relate to the practicum. So we are not going to go in great detail because we will go on week 8, we will just dedicate part of the class for that, for the physical assessment, that you have to do. Okay, so techniques.